For years, the main strategy in fighting MS has been all about defense. But what if we could switch gears and actually go on offense? Today, we're diving into a potential new therapy that isn't just about slowing down the attack. It's about trying to recharge the brain so it can start repairing itself from the inside out. Let's get into it. I mean, really think about that question. It's a total game changer. Instead of just putting up shields and managing the damage from MS, what if we could actively help the brain's own repair crews get back on the job? It's a completely different way of looking at the problem. You see, for the longest time, the goal has been to calm down the immune system, to stop it from mistakenly attacking the brain and spinal cord. And don't get me wrong, that has been absolutely critical. But this new line of research, it's asking a different question. It's asking, what if we could make the brain cells themselves tougher, more resilient, and way better at fixing the damage as it happens? To really wrap our heads around this new approach, we kind of have to reframe the problem. It's not just about the immune system. It's also about energy. So picture this. Your brain cells are under constant siege. This ongoing damage and the body's constant effort to repair it puts an unbelievable amount of stress on those cells. It's like they're running a marathon every single day. They end up with this massive energy debt. And that idea, this cellular energy crisis, is the key to understanding this new therapeutic target. So here's what's going on. When myelin gets damaged, those nervous signals get all scrambled. But there's another piece to the puzzle. The specialized repair cells, called oligodendrocytes, have to go into overdrive to try and patch things up. And that repair work, it takes a ton of energy. In the relentless battle of MS, these cells literally just run out of gas. They become completely exhausted. Okay, so if the big problem is a cellular energy crisis, what in the world is the solution? Well, this is where things get really fascinating, and believe it or not, a little shiny. No, I'm not kidding. The potential solution we're talking about today is actually made from gold. This is it, CNMA-U8. It's a liquid you can drink, and it's filled with these incredibly tiny gold nanocrystals. The whole idea is that these nanocrystals can cross into the brain and act like little portable battery packs for your cells, helping to beef up the energy reserves right where they're needed the most. It's kind of a one-two punch. First, it gives a direct energy boost to your nerve cells and those all-important myelin-making cells. Then, second, by giving those cells the fuel they desperately need, it helps them get back to doing their main job, repairing that damaged myelin. So it's not just playing defense anymore, it's actually enabling the repair process. Now, a cool theory is one thing, but the real question is, does it actually work in people? So, let's get to the good stuff, the clinical trials, and see how this whole idea held up when put to the test. To figure this out, researchers designed two main studies. One called Repair MS, the other Visionary MS. And what's really clever here is that each trial had its own unique mission, designed to answer a different but equally critical question about what this therapy could do. So, Repair MS was all about the how. It used advanced brain imaging to literally see if the drug was cranking up energy production in the brain. Meanwhile, Visionary MS was focused on the so what. It looked for real-world improvements, specifically by testing if it could repair nerve damage enough to improve vision. One measured the mechanism, the other measured the outcome. A really smart setup. All right, so the trials were run, the data came in. What did they find out? Let's look at what the numbers actually showed. And boom, here's the answer from that first trial. On average, a 10.4% increase in brain energy metabolism. This was huge. This was the proof of concept they were looking for. It showed that CNM-AU8 was actually getting into the brain and doing what it was supposed to do, recharging those cellular batteries. So what about that real-world impact? Well, in the Visionary MS trial, patients taking the therapy could read, on average, over 3 more letters on a special eye chart compared to those taking a placebo. Now, 3 letters might not sound like a huge number, but on an eye chart, that's more than half a line. That is a clinically meaningful improvement. That's something you can feel. And you know what? The good news didn't stop with vision. The trial also found some really encouraging improvements in things like cognition and hand dexterity. And when they looked deeper, they saw nerve signals were actually traveling faster, and that there were signs that the myelin itself was better protected. It was all pointing to a much broader effect. And it looks like these benefits stick around. For patients who stayed on the therapy in a follow-up study for almost 3 years, their vision improved even more. We're talking a total gain of almost 9 letters. This suggests it wasn't just a temporary boost, but a sustained, long-term improvement. Okay, these results are obviously really promising, but it's super important to remember this is still an experimental therapy. So what has to happen next? First things first, let's talk safety. So far, through these trials, CNM AU8 has been generally well tolerated. The most common side effects reported were things you might expect: mild to moderate headaches or common infections. Importantly, no serious safety concerns were directly linked to the therapy itself. So the big next step is a much larger phase 3 trial. This is pretty much the final stage of testing before a drug can even be considered for approval. They'll need to show these same positive results in a bigger, more diverse group of people to really confirm that it's both effective and safe for wider use. Which really brings us to this final question. For decades, the primary goal has been to slow MS down, but therapies like CNM-A8 point to a massive potential shift from just defending against the damage to actively promoting repair. We could be looking at the beginning of a brand new era in how we even think about treating MS. And that's our look at CNM-U8. Just a quick reminder that this explainer is based on information that was available as of February 2025. Thanks so much for tuning in.